The Pan American Health Organization is an international public health agency working to improve health and living standards of the people of the Americas. It is part of the United Nations system, serving as the regional office for the Americas of the World Health Organization and as the health organization of the Inter-American system. It is known in Latin America as the OPS or OPAS. PAHO has scientific and technical expertise at its headquarters, in its 27 country offices, and its 3 Pan-American centers, all working with the countries of the Americas in dealing with priority health issues. The health authorities of PAHO's member states set PAHO's technical and administrative policies. Through its governing bodies, PAHO member states include all 35 countries in the Americas. Puerto Rico is an associate member. France, the Kingdom of the Netherlands, and the United Kingdom of Great Britain and Northern Ireland are participating states, and Portugal and Spain are observer states. The organization's essential mission is to strengthen national and local health systems and improve the health of the peoples of the Americas, in collaboration with ministries of health, other government and international agencies, non-governmental organizations, universities, social security agencies, community groups, and many others. PAHO promotes universal health coverage and universal access to health and strengthening of health systems based on primary health care strategies. It assists countries in fighting infectious diseases such as malaria, cholera, dengue, HIV and tuberculosis, as well as the region's growing epidemic of non-communicable diseases such as cardiovascular disease, cancer and diabetes. PAHO engages in technical cooperation with ministries of health and facilitates coordination with other sectors to promote health in all policies. PAHO also promotes the use of research evidence to inform healthcare decisions and policymaking, through the implementation of knowledge translation strategies such as the Evidence-Informed Policy Network (EVIP-Net or WIPNet). Through the Elimination Initiative, it targets HIV/AIDS. In its efforts to improve health, PAHO targets the most vulnerable groups including mothers and children, workers, the poor, the elderly, and refugees and displaced persons. It focuses on issues related to equity for those who lack access to health, and on a Pan-American approach, encouraging countries to work together on common issues and build lasting capacities. Specific initiatives spearheaded by PAHO include the expanded program on immunization, which played a major role in the elimination of smallpox and polio from the Americas, the Tobacco-Free Americas Initiative, the Regional Coalition for Water and Sanitation to eliminate cholera in Hispaniola, the Salt Smart Consortium, the Pan-American Network for Drug Regulatory Harmonization, and a blood safety initiative that seeks to improve blood safety and efficiency by helping countries reach 100% blood supplies from unpaid voluntary donors. A major priority for the Americas is cutting infant mortality, and PAHO is mobilizing new political, institutional and financial resources to prevent an additional 25,000 infant deaths every year. Through application of the Integrated Management of Childhood Illness Strategy, a simple and practical approach in which primary healthcare workers are taught a complete process to evaluate the health status of children brought to a health post or clinic. They learn to recognize signs of disease and evaluate and treat them. They learn to give parents information on how to prevent disease in the home. If they see danger signs indicating the infant could die, they are taught to treat the child immediately or take him or her to a hospital. Improvement of drinking water supplies, adequate sanitation, and increased access to healthcare for the poor are still top priorities for PAHO. With a focus on equity, the organization is intensifying its efforts to have countries know the true state of health of their populations and where the inequalities lie. Program efforts focus on correcting inequality, taking into account decentralization and change of state functions, on showing that health has a role to play in the success of other sectors, and on how attention to health affects positively other aspects of human development. Advocacy in this area is also directed to reducing pernicious gender inequity, which reflects in some health problems of women. The Pan-American approach is a part of PAHO history, and the spirit of Pan-Americanism continues to stimulate technical cooperation among countries in health. PAHO has helped countries work together toward common goals and to initiate multi-country health ventures in Central America, the Caribbean, the Andean region, and the Southern Cone. Experience has shown practical benefits such as the solidarity that helped Central America after Hurricane Mitch, and there are numerous other examples.